Hello, I'm Hanan, and today we're gonna talk about 4 different diseases. Let's start off with the one that caused our latest pandemic, Corona.
COVID is caused by COVID-19, and it has different strains, such as Delta strain in India, and it can be transmitted through air, fluids, and contaminated surfaces. Signs and symptoms at the beginning include respiratory symptoms and include fever, cough, and shortness of breath. However, it has also developed a lot of other symptoms, such as digestive symptoms, loss of smell or taste, and even psychological symptoms. Some reports also concluded skin symptoms. In more severe cases, infection can cause pneumonia, which is an infection that inflames your lungs. It can also cause severe acute respiratory syndrome and sometimes even death. To prevent the spreading of COVID-19, you should frequently clean your hands using alcohol-based hand rub or soap and water, covering the nose and mouth with a flexed elbow or disposable tissues when you cough and sneeze, and avoid close contact with anyone that has a fever and cough and closed spaces.
Obviously, not forgetting the mask that you're supposed to be wearing.
There are many vaccines that have been created now in order to build an immunity against COVID-19, but there isn't a specific one to completely cure it. In addition, these vaccines aren't proven to completely make you immune to it. However, they do strengthen your ability to fight off the virus when you're infected by it.
It really is one bit of a virus, huh? Anyways, on to the next one, which is bird flu. The disease caused by infection with avian influenza type A viruses is known as avian influenza. These viruses are found in wild aquatic birds all over the world and can infect domestic poultry and other birds and animals. Humans are not normally infected by avian flu viruses. Human infections with avian flu viruses have, however, been reported on a sporadic basis. The following are the main symptoms of bird flu, which can arise extremely quickly: a fever and difficulty in breathing. After you've been infected, it normally takes 3 to 5 days for the first symptoms to develop. More serious problems such as pneumonia and acute respiratory distress syndrome can develop within days of the onset of the symptoms.
Hands should be washed often with warm water and soap, especially before and after handling raw poultry. Cooked and raw meat should be handled with distinct utensils. Avoid contact with live birds and poultry. Do not approach or handle bird droppings, ill or dead birds.
I've never held a live chicken before. Let's just see what cancer is all about.
Cancer is caused by mutations to the DNA within cells. The DNA inside a cell is packaged into a large number of individual genes, each of which contains a set of instructions telling the cell what functions to perform, as well as how to grow and divide. Errors in the instructions can cause the cell to stop its normal function and may allow a cell to become cancerous. Symptoms caused by cancer will differ depending on what part of the body is affected. Some general symptoms associated with cancer include fatigue, loss of weight, and paleness of skin. More specifically, for example, brain cancer symptoms include loss of consciousness, paralysis, loss of vision, which is all according to which part of the brain is affected by the tumor. There isn't a specific prevention method for cancer, but you could decrease the risk of getting it by making healthy choices like keeping a healthy weight, avoiding tobacco, and overall keeping a healthy lifestyle. The surgery depends on the type of cancer and its stage. For example, an early discovery of the cancer in a person could be cured with surgery only. On the other hand, some stages might need, in addition to the surgery, radiotherapy or chemotherapy or even both.
What's next?
Tuberculosis.
Ah, yes, tuberculosis! Nobody said that, I think I already knew. It is caused by a type of bacterium called Mycobacterium tuberculosis. It spreads when a person with active TB disease in their lungs coughs or sneezes, as latent tuberculosis is not contagious. A latent tuberculosis infected body shows no symptoms. Meanwhile, active tuberculosis symptoms are hemoptysis, loss of appetite, fatigue, coughing for 3 weeks or more, chest pain, night sweating, and chills. The risk of infection can be reduced by using a few simple precautions. Good ventilation, as TB can remain suspended in the air for several hours with no ventilation. Natural light, as it kills off TB bacteria. Good hygiene reduces the spread of TB bacteria. And of course, in addition to the vaccine that completely prevents the infection. If you have an active TB disease, you will be probably treated with a combination of antibacterial medications for a period of 6 to 12 months. The most common treatment for active TB is isoniazid INH in combination with 3 other drugs: rifampin, pyrazinamide, and istambi-2. Thank you for watching and have a nice day.